There's a lot of videos online about how exactly the Weber and Rinne test work and how to kind of intuitively understand that. This is not going to be about that. I find that when I am taking the exam, it ends up taking a lot of time to kind of intuitively understand that and then work out what the diagnosis is. So today I just want to give you a quick mnemonic so that you can kind of get those easy points on test day. So first thing to understand is which one is the Weber and which one is a Rinne. So for the Rinne, I like to think that the word Rinne sounds like the word pinna. That's P-I-N-N-A. That's talking about the external part of the ear here. So because the Rinne, it goes next to that external part of the ear, that's how I remember Rinne versus Weber. Some people for the Weber, they also like to think of like a W-shaped antenna kind of coming out of the forehead. So whatever works for you. I just remember that the Weber is the one that's not the Rinne. So as long as you have one of those mnemonics. The other thing to understand is that with the Rinne, unlike a lot of tests in medicine, when you're normal, you actually would be considered having a positive Rinne. So you can see here in this picture that I've given this guy some plus-shaped earrings, and that kind of helps me remember that in the normal state, it's just going to be positive Rinne on both sides. Now, of course, that doesn't necessarily mean that your hearing is normal. As we'll see, you can get the positive Rinne, which means air conduction is greater than bone conduction, in both the normal state, but also in the state of sensorineural hearing loss. So let's get into the mnemonic. So the phrase that we're going to remember is the phrase NARC PROWLS. So we're going to use the letters of that phrase to remember what the different tests mean. So here, if we have a negative Rinne, then it's going to be conductive hearing loss on that side. So in this test, honestly, I don't look too much at the Weber. If I see that there's a negative Rinne, I know there's one thing that causes that, and that is that conductive hearing loss. And so whichever side gets the negative Rinne, I know that side has the conductive hearing loss. And with the word prowls, so if you get a positive Rinne, remember that's the same thing as the normal, so that's not going to help you. So you look and you get the positive Rinne on both sides, so then you're going to go to your Weber, and then you're going to see that your Weber, whichever side your Weber lateralizes to, the opposite side of where your Weber lateralizes, that's the side that's going to have the sensorineural hearing loss. So here we can see that it localizes to the unaffected ear. So here we know that the Rinne, it looks just like it would in a normal person, but we know this person's telling us that they're having some hearing problems. So we go to our Weber, we see which side it localizes to, and we say, okay, on the opposite side, you must have a sensorineural hearing loss. And again, that lateralization is just which side can you hear better on. Here's a few vignettes that you can look at. So remember that just because you know whether it's conductive or sensorineural, that doesn't necessarily give you the diagnosis. So these features can help you to narrow it down further. So you can go ahead and pause here and review these conditions as well.